And what we have here is a medical device, an integrated medical device system. It's a platform that tests your autonomic nervous system, vascular function, as well as provides risk assessments for cardiovascular disease, as well as metabolic disease. Our device has markers that provide early detection of metabolic diseases, type 2 diabetes, for example, as well as vascular disease. So we have some predictive markers. Now, I'm going to get into the markers in much greater detail as we go through the software, but I just wanted to present this the main features of our testing, which include a cardiometabolic score, an overall score, as well as the different areas that we test for: autonomic function, vascular function, and lifestyle. And so this CMR score, and it's, of course, it's an off-label score, but in studies that we've performed show that our marker here, which is an algorithm that's derived from the different modalities that we test, is basically a marker, a predictive marker for diabetes, and it's non-invasive. So diabetes, we know it's a 10-year process. So diabetes begins 10 years before the actual lab results are presented. So here is when lab tests are diagnosing the disease, but prior to the actual fasting glucose, OGTT, all the different lab tests to diagnose diabetes, there's damage that's occurring 10 years previous. Damage of the autonomic nervous system, the nerves, damage of the arteries, okay? And this is what we're capturing with our system, okay? Early detection, predictive markers, as well as markers of complications, okay? And those complications, as you know, are autonomic neuropathy, small fiber neuropathy, and then vascular problems, endothelial dysfunction, PAD, hypertension, so forth and so on. So diabetes is a process that begins 10 years before diagnosis. We're capturing damage of the nerves and the arteries, okay? And we're also capturing damage that's a result of the disease state. So you can see that we have a pretty comprehensive device that includes a lot of different markers to help the doctor determine, A, if their patients are going into cardiovascular disease or diabetes, okay, with high accuracy based off of the tests, to determine if their patients are going into complications related to metabolic disorders, whether they have neuropathy, okay, whether they have vascular disease or problems with blood pressure. And then, of course, objectively can evaluate the patient's lifestyle, okay? Not subjectively the patient telling the doctor, yeah, I exercise, yes, I do this. No, we actually can objectively measure their fat mass, their body mass, as well as their fitness. And so that's pretty significant when you think of everything integrated into one system. And similar to the dashboard, this provides the scores for autonomic function, vascular, the lifestyle, the trends, with some notes, so the physician can input some notes, or the technician can input some notes. The graphs, okay, so this should provide all of the reports, so it does. It provides autonomic, vascular, the lifestyle, and the overall score with some commentary.